What's good, family? Let's get it going. Hope everybody is doing well, man. I felt it necessary to go ahead and get on live. It's been a little minute since I got on. I'm over here editing some videos that I'm about to drop, but I felt like I wanted to just hop on to see how y'all feeling out there. So, if you're on and you're interested, go ahead and drop. I'm gonna go and drop a poll off of this thing too, real quick. All right, let me drip this. What's up, family? What's good? Get my edit on real quick. Dropping a video in just a second, but I felt like it was probably important for me to jump on just to see what y'all on. I got a poll going real quick. Let me know, man. Let's talk about it. I'm over here trying to edit my video real quick. What's up? What's up? How you doing? What's going on with you? How y'all doing? How y'all doing? I'm doing well, doing well. Over here working on some editing, and I felt like it was probably important to jump on to see how everybody's doing, see if I could be of service, answer any dental related questions. I got the poll here. A lot of people saying that they don't know. Go ahead and drop in the poll. Let's talk about it. Let's talk about it. Yeah. We got our haters out here. Appreciate you. Keep going. Go ahead and remove you up off of here, man. I don't even know who you are. It's crazy. Yeah. Let me flip this screen real quick. So this is me. I'm editing my videos right now. So I got my double screen action going. This is how I pretty much edit what I get going there. Right now it's 2:55. It's 2:55. 2:55. I see a lot of people don't know what they need. I guess one of the things that I always start out with when I talk to patients, and again, this is just, you need to go see somebody if you're interested in getting some type of dental care, but I always like to talk real general when I get on live, just to answer the questions that whoever pops up, so I can help you guys, hopefully with some of your decision making when it comes to some of your dental care. Appreciate you, Brittany. Appreciate you. So want to just hop on. Looks like a lot of people don't really know what they need. I think some interesting 7272 said, how bad does a tooth have to be to not be able to be recovered? So there's several different treatments that it really just kind of depends. And I hate to say that. I hate to say that. Let me see if I got a photo here. I'm going to pull up real quick. Give me just a second and I'll show you, okay? because there's a lot of different treatments. So there's certain times where you may need to have a tooth extracted. Extracted pretty much means that the tooth needs to come out because you either have pain, discomfort, or the tooth is non-restorable, meaning that there's nothing that you can do in order for it to work. Let me see if I got a good picture. I want to show y'all the best picture. Let me see. I got y'all. I got y'all. Boom. I got a good picture right here. Check this out. All right, this is a good picture. I'm gonna pull it up on my screen. I'm gonna make it big for y'all so y'all can see. Okay. Now this picture right here. Can y'all see that? So this is pretty much a photo of teeth that cannot be restored, right? Uh, these teeth cannot be restored because they have really, really big cavities in them. So this tooth right here is partially impacted. This tooth is pretty much gone. It's likely that there's nothing that can happen to this tooth as far as like making sure that it needs to be filled. This one can't be filled. This one likely could probably be root canal, but it really depends on how far the decay goes down. So these 3 teeth have something going on with all of them. So this one got a cavity, this one got a really, really big cavity, and this one also has a cavity, but it's not as big, almost like 3 little pigs almost. But that is pretty much, you know, what when you talk about what teeth need to be removed, that's pretty much so how big the hole is. It has a big part of it. So if you have a really big hole that goes underneath the bone level, that tooth is deemed non-restorable, meaning that that tooth cannot be fixed. But if you have a little smaller cavity, sometimes it can be fixed with either a filling or a crown. And sometimes we can do non-invasive things like put some type of medicine on it to kind of help slow down the cavities. We call that silver diamine fluoride, SDF. So those are some of the things that we use to help if you have a cavity. But it really just depends on how deep the cavity is, right? Let me see if y'all got some more questions. How does the hole in your tooth appear, and how did you get rid of it? Well, currently, I don't have any holes in my teeth. But I help other patients with holes in their teeth. So, you know, it really just depends. I think probably one of the things that I learned, you know, early on as a child, my mom, she had us in the dentist like all the time. So, you know, that kind of really helped to make sure that I didn't run into a whole lot of problems as an adult. So, you know, that's kind of one of the things, But I appreciate the love. I appreciate, you know, what you guys are sharing for real. Let me see what else I got. All right, I'm gonna get back to. So it looks like a lot of people just don't know what to get, right? Anybody got any other questions in the chat? That was a great question for real. I appreciate it. I'm trying to make sure I ain't missed nothing. Looks like we good right now. Let me get you up off her, man. We gonna get you on up off her, bro. Boy, always got to be somebody, man. I tell you, boy, people is crazy. Hey, what's going on? What's going on? How y'all doing? How y'all doing? From the Philippines, huh? Appreciate you being on, man, for real. What stages are there in cavities? Like the picture you show is probably in game, but how does it start and how does it end? Ooh, you got some fire questions, man. You are the right person on the call, man. Give me just a second and we'll talk real quick. I'm gonna pull something up on Google. I don't encourage anybody to do this. I kind of know, not trying to scare nobody, right? Let's see. So I got Google up. I'm gonna pull up this real quick. Cavity progression. And I'll talk you guys through this real quick. All right, yeah. So I think one of the things, so I'm looking at this picture, right? And I think one of the things that everybody needs to recognize when it comes to cavities is there's certain layers in your teeth, right? So you have the enamel layer, which is the whiter covering that everybody sees when you smile. Then underneath that, you have dentin. And then underneath that, you have the pulp. The pulp is what nourishes the tooth. It has an artery, a blood vessel, a nerve, and a lymphatic system. And teeth are almost, they are considered organs. Some literature says that they're organs because they house all of those different things. And then on the roots, we have what's called cementum. So I'm going to go ahead and pull up a photo because, man, you guys have some awesome questions. Awesome questions. So she said, she was asking about how deep these cavities are. I think this is a good picture right here, right? Let me pull it up so y'all can see it. This is somebody, I can't see that one. Dang it. Hold on. Let me see if I can find something else. So all those layers that I was telling you about, right? Let's see. I don't know whose page this is, but I'm going to use the picture and make it big. This is somebody's dental picture and like far away, but it has an easy cartoon to kind of follow. So we'll talk about it real quick, all right? All right, so I'm going to flip my screen around, right? And so can y'all see that? No, y'all can't see that. Let me see if I can fix it. Boom. Let me flip it this way. Oh, yeah, that's good right here. All right. So this is probably, this one right here is like, so the outer surface, a little white layer, right? That's called enamel. So you can see how right here, it's not really that deep, right? So this one could potentially be fixed with the SDF. So the silver diamine fluoride stuff that I was telling you about, it's like a little medicine that we put on there to kind of helps harden this cavity and seal it off. This one's a little bit further in progression. So it's actually approaching the second layer, right? And so this one you might end up both of these you can potentially have pain, but this one you're really going to start to have a lot of pain and discomfort with this too. Sometimes when you eat certain things, as far as temperature foods, like so like if you're eating like something like coffee or tea or something like that, sometimes you'll have a little bit more pain with this one. Now this one is going to really be jumping, right? So this one is through the enamel into the dentin, and it's really, really getting close to the nerve. So this one is usually when a patient is like, I'm in pain, I can't take this no more, and I need this tooth taken out. Same thing with this one here. This one is like pretty much like, this one's gone for real. Like, it may not necessarily need to be extracted, but you could see about maybe doing a root canal on this tooth to help. So teeth actually go through different phases, right? And so they can go through phases like, so we call it normal. Then it can go into like a reversible phase, right? And then it can go to an irreversible phase, meaning that the tooth is no longer able to heal itself. And then it can go into a necrotic phase or a dead phase. And that pretty much means that tooth is dead and you don't have little to no sensation with the tooth, all right? So it's a lot to it, but that's pretty much the gist of it. That's the quick and the quick version, I guess. Man, 15 minutes went fast. Appreciate you, Noxabana. Appreciate you. Roger, what's up? I was feeling around with my tooth and a piece of my tooth fell out. What do I need to do? Man, so listen, Roger. I would say that probably the first thing is, are you having like pain, discomfort with it? Like when you're drinking certain stuff, are you feeling like a lot of pain with the tooth? Again, I'm not here to diagnose. I got to keep saying it. I'm not here to diagnose. I'm just here to give information and point you in the right direction. So you're not having any pain. Okay. Have you ever had any pain at any given time? Again, I'm not here to diagnose. I'm just asking questions to help to see how severe it sounds like. If you go to the dentist, we have to do a clinical exam, x-rays, and that's really what helps us determine what type of treatment you got to go. But I'm just talking, right? We just having a conversation. Talking to Roger like we just walked in the grocery store and I'm just talking to him. So you're not having any pain right now. It was hurting a while ago. It sounds to me, and it really, once portions of your tooth fall out, it could either be a filling that's went bad. So if you had a filling on that tooth, maybe. Sometimes, portions of it hurts when you drink. See, yeah, right there, boom. So what it sounds like to me is you're not having any pain right now, but it sounds like it's going in between those two phases that I was telling you about. So it can go from reversible meaning that the tooth is able to heal itself and you're not having a whole lot of pain discomfort. And then it can move into irreversible. Irreversible means that, the tooth can't heal itself, and you're pretty much going to either need a filling, a crown, extraction, or root canal. So that it's a lot of information, but it sounds to me like you probably really need to go see about talking to somebody, Roger, to see about how bad this is. Prevention is key. I always talk about that in all my videos. Like, it's important to, one, have a relationship with the dentist if you can, and then two, um, if you don't have a relationship with a dentist, at least try to have a really, really good home care regimen, meaning that you're using a soft bristle toothbrush, you're flossing, and then you're also making sure that you're being mindful of any changes inside of your mouth. Drinking lots of water, all those things are important, right? So that's probably what I would say, Roger. I hope that helped, man. I know it was kind of all over the place, but, yeah, it's good. Eve 400, what's up? Yeah, man, appreciate you, man. I appreciate you, Roger, for real. Um, Eve, she said, he or she says, can a dental implant cause problems over time? So I know there's not cartoons, commercials that come on TV all the time, and everybody's a candidate for implants. And implants are a really good solution. They have a really, really high success rate. But what I think sometimes we don't talk about on the commercials is you still got to take care of these things like your natural teeth. You can have something called periimplantitis, and pretty much what that means is the implant is starting to fail. And so when you start to have implants that fail, they can become loose. There can be infections. And then sometimes implants can just fall out because the environment is either so inflamed or, your bite isn't right. So many different things, but implants can cause problems over time. A lot of the things that we do in dentistry have a shelf life. Like, I feel like if there's any work that I've done and it lasts anywhere from 15 years plus, I feel like I've done my job, right? But these things aren't forever. And I know, especially if you're not taking care of them. And implants are so crazy because it's such a huge investment on the front end. And I think a lot of times people don't really think about, maintenance and how important it is for you to go and see somebody if the implant is, saying not really doing the way it needs to do. So if you have pain, discomfort, or, other things, you need to go see somebody. I mean, I think that's probably the main thing that people kind of forget about when it comes to implants. It's not just like a set it and forget it type of thing. I hope that helps. But yeah, let's see what this poll is doing, man. All right, y'all getting loose on it. So a lot of people don't know. Looks like a few people think they need extractions. Some people think they need a crown, and other people think so. A lot of people don't know. And then people think they need a crown. Some people think they need an extraction, and some think they need some fillings, right? Appreciate you, Eve, man. I don't know if I'm saying it right. No disrespect, but I appreciate it, man. I want to talk to you guys real quick about, this difference between, I'm probably staying on for probably about another 7 minutes or so, for real. But I wanted to talk to everybody about the difference between a filling and a crown. So sometimes, like I showed this cartoon, right? I'm gonna show it to the people that just jumped on real quick. Well, it's not a cartoon, it's a picture. But I'm gonna show you guys this picture, right? I'll just swing it around. All right, I don't know if y'all can see that. Hope y'all can see that. Okay, yeah, y'all can see that a little bit. So, right. So, we're talking about fillings and crowns. So this is a good picture. So this tooth right here is impacted. So this is probably a younger person. But you can see this discoloration right here, right? That's likely that it's going, once the tissue and it comes fully out into the world, and this tissue and everything, kind of retracts and the tooth erupts all the way. This one is likely a good candidate for a filling, right? This tooth right here is likely that you probably need to have that bad boy extracted for real. And this tooth right here is likely, depending on how deep it is likely that this can be like a filling, a large filling, or a crown, right? So it's like a progression. This is a good picture. I wasn't expecting it to be like that, but it's a good progression on like the difference, right? Because I think one of the things that I noticed with a lot of my patients, right, is they struggle because they feel like they don't know how bad this thing is. And they think that, what they have going on is probably the worst of the worst, right? And I think, sometimes that can really hinder patients from really wanting to get things taken care of. Um, and it's also, the decision is also an expensive one because when you put things off, it's likely that it's going to cost a little bit more than had you went in when it first started. So my advice, if anybody don't hear nothing else that I say, my advice would probably be to go see about what you got going on. Because there's a lot of people that just choose not to, and they just feel like it's just so bad that they don't even want to know. And then they only come to the dentist when it's blowing up. But having a relationship is a whole lot cheaper than you just kind of popping in and out, right? And only coming when things are wrong, because it's not really that helpful, man. Like when you do that and you pound, you kind of bopping back and forth or whatever like that, it's not really helpful, and it actually ends up hindering you. Because what if it was something that you could have just got an easy feeling on, but then you chose to wait, and now that bad boy got to be extracted? Kind of things to think about. Like it can really get that bad and get that real. You know what I mean? Like you thinking that everything is good, um, and it's not. So, my advice is always just to try to be a little bit more proactive when it comes to, your dental care or just your overall health, right? Things are really crazy in the world right now with just all the things going on. And I think the only thing that you can really control is your attitude, your effort, and, your health. Health is wealth, man. And, this is one small piece of what makes you who you are. But if you don't take care of you, man, it's going to catch up with you. And I'm not wishing no ill on nobody on the call, but it's just important just to make sure that you do all you can to make sure that you'll be here for a little bit longer, because there's still a lot of life to live, right? All right, man. If anybody I'm about to get back on this editing. Anybody else got any questions? I see I got a couple more in the chat. Appreciate Roger and something interesting with these dope questions. My family from the Philippines. Appreciate Brittany sharing and giving me the like. It's all love, man. I appreciate everybody on the call for real. It's a blessing, man. Hey, man, I appreciate you. Something interesting in 7272. Um, a lot of new information and very educative content. Keep it up. Blessings. Appreciate it, man. I really, really do. Really, really do. I'm just here to help, man. Really, to be honest with you. I love what I do so much that I'll get on YouTube and talk about it for free because that's what I do, man. I do it day in and day out, and it's an honor to be able to serve people just like you. And I think it's also kind of cool that I can reach people that are miles and miles and miles, and even some over the water. I had somebody in the chat today that was from the Philippines, so I'm incredibly humbled, man, just to one practice, but also to share what I learned, man. I feel like a lot of people holding on to a lot of stuff. We're in the information age, but I think it's important just to, whatever it is, whatever you have to bring to the world, that you share it. Can't harbor it, man. We all gonna be here forever. So like, make your impact, make your voice heard, make your gift, um, make it work for you, man. And hopefully it'll help somebody else too along the way. That's all I ask. Man, this has been dope. This has been so cool hanging with you guys. This is actually one of the longer ones I've done because most of the time I'm in the car, right? Driving. And it always kind of makes me feel a little antsy, man. I haven't been on. I'm probably gonna go ahead and push it to about 30 minutes, man. I am feeling good about this one for real. Got a lot of interaction with the poll there. People really active there. So I appreciate that. I appreciate that. I'm gonna go ahead, and if y'all ain't got no questions, I'm gonna go ahead and just get my video going real quick and see what I got. Let's see what you got here.
The ocean continues, but the land is slowly disappearing. Gum recession works the same way. It's slow, it's steady.
Y'all want to see what I'm looking at? Like, so right now I'm actually working on a video talking about gum recession, right? So there's a lot of things that we do, right, that lead to gum recession. So sometimes, with gum recession, you can experience, I'm gonna show y'all a picture, right? So when you have gum recession, the teeth can start to look a whole lot longer than what it looked like before, right? Miss Independence, what's up? You got a question? I'll just stop what I'm talking about just to talk to you. Miss Independence, got a question? I'll wait on you. I'll give you just a little bit, and I'll get back and talk about what I was talking about. I'm pregnant. What can I do when I have a tooth infection? So, ooh, this is a good one, right? So, this is a great question. So, one of the things if you were to come to my office, one of the things that I would share with you is we try to figure out which trimester you're in because there's certain times where the babies are extremely vulnerable, and usually that's the first trimester because there's a lot of development going on with the fetus, with the baby, right? And so usually during that time, unless it's something like super urgent, like say for instance you got an infection that's really bad, most of the time we kind of defer things. I mean, of course we want to keep you clean, get your cleanings and all that good stuff. But like doing some of the more invasive things, a lot of times if it can wait, we'll try and wait for a little bit. But if you do, it just really just depends on how severe it is. I mean, most of the time, again, I'm not diagnosing nobody. I got to keep saying that every 5 minutes, but I'm not diagnosing anybody. This is just information. We talking, we family. That's it. But a lot of times, what you'll see, yeah. So you're in my first trimester, and I'll be in my second trimester on the 30th of this month. Okay, good. So you almost out of that window. So some of the things that when it comes to from dental care, but one of the I don't want to scare you either though. So like when you go to the dentist, right? And you say for instance you have an infection, they're going to ask to take pictures. The radiation that comes from those pictures in high doses, hear what I said, in very high doses can affect the baby. But a lot of times, what we'll do if we have to take pictures in the first trimester is sometimes I'll put that big old lead apron on, the heavy thing, right? And that'll kind of help prevent the radiation to go towards your stomach, right? Or in that area. So sometimes we'll put on like a thyroid collar, right? And then blessings, love from Jaman. I appreciate that. Sometimes we'll throw that thyroid collar on, and that'll protect. There's a lot of vessels and nerves and arteries and things like that. So sometimes we'll put a thyroid collar on to protect that. But if there's patients that are pregnant, we'll probably end up throwing that lead apron on. And that lead apron is going to help prevent a lot of the scatter coming from the X-ray unit inside of your body. And it's just only going to go right, to that area. Oh, so you're 12 weeks pregnant, and you said, my dentist not doing anything. I've been going through this for months. Man, no shade to that dentist. But you might want to see about somebody else. There's so many capable dentists just throughout this country, throughout this world. I mean, not even just in America, just everywhere, man. There's a lot of men and women, man, that are just as passionate as I am to serve, our people. So I think, if you're hurting, I think it would probably be a good idea to go see somebody, share with them so that one, you can figure out how bad this thing really is. Because it can be bad. What if it's something that you want to that you need to have done right now, and why wait? Why wait if you can help it and it's not gonna hurt the baby? Why wait, right? I hope that helped. I'm going to and I have a proof of pregnancy. Good. That's good. Angel Rowe. Are the teeth aligners you see online reliable? Man, it really depends. So like I'm seeing so much stuff now, and I'm gonna try to really do. Let's see what you said. I definitely need it done. I've been doing salt water is good. Depending on if you have A hole in your tooth, what you can potentially do is try to do, there's some things that you can get over the counter, right? That you can kind of mold. It's like almost like, and if you have exposed area, you can put that inside of your tooth to kind of help give you some relief. Because sometimes when you have a hole in your tooth and you drink hot drinks or cold drinks or you eat certain foods, sometimes that can really cause a lot of pain and discomfort because the nerve is exposed, right? And so you can go to Walgreens or CVS or wherever you go, the grocery store, whatever, and or pharmacy, and see if they have some of that, or even Amazon. Amazon got a lot of stuff too. So you can go to any of those places, and you could likely find something to kind of wall it off. Now, I wouldn't encourage you to do this long term because if you can imagine, almost like a crock pot. So you got a cavity there, then you put some on top of it, and the cavities never got took out. So you got a hole there, and the cavities never got took out, and you put some on top of it. Where are the cavities going to go now? They're going to go down, and then they're going to start working and eating and go all the way down to them teeth, into not to your teeth, into your roots. And what's in the roots? Your nerves, and then it can lead to a whole nother issue. I was talking to my homies earlier today about this, right? They were asking about cavity progression. And so this is where you at right there. So if you put something on top of there, it ain't gonna do nothing but just keep going down into the roots right there. You don't want that, right? So just something to think about, Ro. Oh, not Ro, Miss Independence. Miss Independence. Man, so you really probably need to, it sounds like Miss Independence, you probably really need to try to get on some type of antibiotic. And again, I'm not diagnosing. I got to keep saying it every couple of minutes, but you really probably need to get on some type of antibiotic and from their provider. And they have to take pictures to see if you really have an infection there, if you have a pimple, if you have a bad smell coming out the tube, if you're experiencing pain, like you just sitting there watching TV with your family or your friends and you start to have pain, it's likely that, the infection is pretty bad, right? All right, let's see what you got. All right. Oh, Orange roll. What's going on, man? I'm gonna go ahead and answer your question. Now, you said the first question you said, are teeth aligners you see online reliable? Man, it really just depends. If you are doing it yourself, sometimes with shifting and moving teeth, you really need to see somebody. And I know it probably is going to cost a little bit more. A lot of people are choosing to do this online stuff because it's inexpensive and then it's also, um, it's cheaper, it's easier, and you can do it in the comfort of your home. But with those tooth aligners, one of the things that they don't get a chance to do when you're doing it just online and you're not necessarily seeing anybody is that you can't see if there's cavities there. And so, just like I was sharing with Miss Independence about putting something on top of a cavity, where is that going to go? So you got the tooth aligner on there. Where is that decay going to go? If you got a huge cavity, but you're trying to get your teeth straight, you run into a bigger problem. You're going to end up losing the teeth that you're trying to straighten. So, again, not here to diagnose anything, but what I will share is it's important for you to go and get some x-rays and maybe see a dentist to make sure that you don't have any cavities or whatever like that before you start going down the rabbit hole with the tooth aligners. Mm, let's see. Angel, you have crooked teeth and a cavity, don't know what to do. So, orange roll. Check on the cavity first, my friend, and then we can see about straightening them things out. Because if you got a cavity, teeth are neighbors, right? So you trying to get this tooth, both of these tooth is all crooked or whatever like that. And you're trying to get it straightened out, and teeth are neighbors. So because they sit so close together, if there's something going on with this tooth, say right here, you got a cavity in between this tooth here, what's it gonna do to this tooth? It's gonna communicate with it, and then over time, you'll have a cavity on this tooth too. So it's just important just to, what I'm saying, you gotta get that checked out, man. You gotta get that looked at, man, first before you start talking about straightening some teeth out. And I also see you think that you're completely hollow after a cavity. Yeah, man. That means like it's probably progressed, man, pretty far. So you definitely need to go ahead and see about that, man. Definitely need to go see about that. Let's see what you got. Definitely in pain, Miss Independent. Yeah. You got to go see about, again, I ain't here to diagnose nobody. Not at all. To diagnose, you need to have an x-ray and a clinical exam. It's probably like my 15th time saying that, but I'm going to keep saying that because I don't want everybody just to think that what Ken the dentist is saying on YouTube and I'm not looking inside of your mouth is true or law. It's not. So, you got to go see somebody so that they can take the photos that they need in order to get you the care that you need, right? Because if you don't, then, me talking to you through the screen, it's not going to help. It's not going to help. So you got to make sure that you get pictures so you can see how far it is, because it's going to determine how far it is, and it's going to also help determine what you need. So I drop a poll right here, right? And so filling a crown extraction, or you don't know, right now y'all in the field of not knowing. And so the x-ray and the clinical exam is going to tell us whether you need a fill in the crown, an extraction, or a cleaning. So that, what I'm saying, so we can know the progression. So like if you don't know, you don't know. But how do you know? You got to empower yourself to get the information. How do you get the information? Go to one of these places, one of these DSOs, and they have like little things where you can just do the x-ray, right? This is probably what this is free game right here. This is free game. Go to one of those DSOs. So they're gonna charge you to do a clinical exam and take x-rays, right? Usually they got something like where it's like $99 or something, or $29 or whatever. See what they say about what you got going on. They'll print you off a treatment plan with all the stuff that you got going on. Some of the stuff is for them to get money. The other stuff is stuff that you actually really, really need. And use that information. There's also so many different areas where you can get free dental care. Where am I talking about? There's so many different places. So there's one that I've had an opportunity to serve on. It's called RAM. RAM goes across the United States and does free dental care. RAM. Look it up, and they will help you and get you. They do cleanings, they do extractions, they do fillings. RAM is a solid business. Like, it is a solid place to see about getting free dental care. There's also different schools that you can go to. One of the things about going to a school to get dental care is going to be a lower cost. And everybody like, man, I ain't gonna let no student work on me. Listen, I was a student. Them professors up there are getting paid to ensure that the students know what they need to do. So before they release them out into the clinic, there's a lot of didactic stuff that has to happen before they actually even touch a patient. And then if it's going south, you better believe the professor's gonna step in before that student does any harm to jeopardize the dental program or the school. So those are some really good places to go to see about getting inexpensive dental care. Like I said, there's some free ones. The RAM is a good free one. Any dental school that's in the area is free. There's also some community care places that you can go, right, that do free dental care, right? Where they do like maybe not free, but maybe on a sliding scale. So, they may be like, you may need a filling or whatever like that, and they may charge you $22 because of your, based on the amount of money that you have or whatever like that, because you have to fill out some information and paperwork, whatever. But there's a lot of things that, you guys have options. And I think that's probably one of the things that I'm really so passionate about, is because a lot of people just don't know what their options are. And they just feel sick about going to a dentist. They feel bad about, just their teeth. And a lot of times it ain't that bad. Like I get patients all the time, man, and be like, I know this is probably the worst mouth you ever seen. And I always try to tell them like, no, it's really not. You know what I mean? I've seen some things in some textbooks that are just, it'll make you scratch your head like, wow, I can't even believe this could even happen. But there's a lot of different things, that you have to um, you have to really think about when it comes to your dental care, right? It's a lot of things that you got to think about. But I appreciate these questions, man. It is really, really helping me, and I know it's helping a lot of people that are on this call, man, and just on this live. Um, because a lot of times you think that you're the only person that's affected, or you're the only person that got something going on. But I'm telling you guys, it's a lot of people out here suffering with it, with the price of everything going up. Milk is $6 now where I'm at, and it's crazy. But there's a lot of people like me that care about you and want to see you well, want to see you, turning this thing around when it comes to your health, man, because health is wealth. Health is wealth. Again, I'm gonna say this right now. I'm not diagnosing anybody. I'm just having a conversation. We met in the grocery store, and I'm just talking to you as a friend. That's it. Don't go nowhere and say Ken the dentist said. Please don't do that. But please subscribe and like. I appreciate it. It'll definitely help for the algorithm to pick up my stuff and get it to some more people just like you to help, hopefully, somebody. Let's see what you got. Let's go back to the chat. Man, the Sweater Factory. Bro, okay. So you said, what's your viewpoint on amalgam? So I think amalgam, so I still do amalgams, right? Amalgams are a really good, inexpensive way to fill a tooth, especially when you have a larger filling, right? So if you're doing like a crown, most of the time those things is gonna probably be anywhere from $15 to $2,000, depending on where you're at. But what an amalgam does, it helps to, it has different metals in it, right? Mercury is one of those metals, but the amount of mercury that's in the amalgam is very, very small. But I know on YouTube, and a lot of people are saying they don't like it. I get it, I understand. But I was trained with an appreciation for amalgam. It is a tried and true dental material. I know a lot of people are getting away from amalgam, and a lot of times it's because the leakage of the amalgam, over time. Um, it's the leakage of the mercury. I shouldn't say amalgam, the mercury in the amalgam. And a lot of times when you remove amalgam, I do it with most of the time when you have anything removed, there's going to be some suction in there. So a lot of the fumes, a lot of the metals and things like that is going to go not into your body, but into the suction. But there's a lot of people that are against amalgam. There's a lot of advances with composite too. And composite is really, really placed the right way, done the right way. It's a good material. I mean, I'm not even gonna lie to you. It's a really good material with the composite resin. The only thing is sometimes you may have a micro shrinkage, and sometimes that leads to they have to be replaced a little bit sooner or more often than amalgam. But amalgam is a good material. It's lasted for some time now, but I know there's a lot of people that are against it, and I get it. But I still use amalgam today. I mean, especially, I deal with a lot of patients that brux or grind their teeth, that have a lot of dental trauma, meaning that they clench and grind their teeth. And amalgam is a really good material for individuals that have a really, really hard bite and then also kind of grind their teeth too as well. So I still use it. It's not at the top of my list, but most of the time if I need to use it, I have no reservation about it though, for sure. Hey, I wish I was in your city too. And I'm finding, man, I can't wait to travel this world to help people, just like the people that are on this live right now, man. I am, God willing, man, I hope to just travel across this country, this world, really helping people. So y'all stay tuned, man. I'm excited to be able to do that for real. To meet people just like you, to help people. More in store for sure. Sweater Factory, you said I had one place in 23 and was concerned about it at the time and never had one done before. It's a lot less sensitive. Come on now. That's what I'm saying. Come on, man. That's what I'm saying. Listen, you already answered your own question. That amalgam, man, what did I think of what I really like about amalgam? So it has different metals in it, right? But it almost adheres to the teeth. It's almost like gold. Like gold is a real malleable or a material that you can mold and shape. Amalgam's the same way. So it's almost like it gets better the longer that you have them. I have patients that I've seen that have amalgam fillings that were done in the 90s, right? Before I even started practicing dentistry in the 90s, and they're still holding up. They're still holding up. They're still strong. So I know there's a bad rap about amalgam. I'm not completely against it. It's a good material. It's been used for hundreds of years, for 100 years or so. GV Black, he knew something when he put that thing together, because I'm telling you, it's not that bad. I don't have any amalgams in my mouth, but if I needed to, I wouldn't be opposed to it, for real, to be honest with you. Oh, and it looks like you got less sensitive than the white one. See, that's exactly what I was talking about. That micro strictures that I was talking about, the Sweater Factory. Sometimes over time, especially how they're cured, with the composite resin, it can shrink. And so when it shrinks, it sometimes there can be communications in between your tooth and the filling. And then over time, if something gets trapped in there or whatever like that, hole gets bigger. Cavities don't really need the bacteria in your mouth don't really need a whole lot of space in order to wreak havoc on your tooth. And so it sounds like you got a little bit of sensitivity there. If it's a really big tooth colored filling, you might have to get crowns in the future. I don't know, but it's still good. Miss Independence, thanks for sharing your thoughts with me and going to get some rest and have a blessed day. Appreciate you. Appreciate you. Where are you from? United States. I was once a man in a woman's body. Blessings. I don't know what you're talking about, man, but all right, whatever. Shut up. All right, sure, man. You tripping. I'm going to get you up off of there. All right. Man, there's some real people on here, man, that really need some help. So um, I'm trying to get all the distractions off because there's some real people that really need some help, man. Yeah, yeah. Oh, you good then? You in there? Yeah, 10, 15 years, man. Yeah, you got any dental care that's lasting 10, 15 years, man. You all right. In my opinion, you all right. I'm not on here diagnosing. This is not, we just having a conversation, not here diagnosing. You have to go see a dentist, take pictures, do a clinical exam. Just on here editing my video right here. So I'm editing my video and talking to my people. That's what we're doing right here. Just editing my video and talking to folks, not diagnosing anybody. All right, so what you got, Glenn? Do you need to keep wearing retainers forever from braces? Yeah. Man, all right, so let's see. This is a good question. How can I answer this for you? More likely, yeah. What a lot of general dentists don't necessarily share sometimes. So there's fibers that wrap around each your tooth, right? So your bone's in the socket. I guess it's a picture. Let me see if I can pull this up for y'all. Periodontal ligaments. Man, y'all really helping me to be on her. This is the longest I've ever been on a live. I never be on her like this for real. But I appreciate the love. I really do. All right. So my buddy, I'm gonna show you this real quick. So I got this picture here. So around each individual tooth, can you see that right here? There's you see these little purple things inside of that picture? So that's periodontal ligaments. So there's so many different types of periodontal fibers. And why am I talking about fibers around your ligaments? Well, you asked about when you have braces. So your teeth grow in a certain type of way. Sometimes when you have braces or you use Invisalign or whatever like that, they shift and move. And so those ligaments that I just showed you on that picture have memory. And this is why sometimes the orthodontist or the general dentist says that you really, really need to make sure that you wear your retainer because those fibers have memory. And over time, teeth can shift back, but maybe not as severe as what they were prior to. Because obviously, if you're doing orthodontics, you probably had maybe tooth removed or some space created. But sometimes teeth can shift a little bit as it relates to when you wear um, dental appliances or braces and things like that. So one of the things about if you don't want to wear retainers, there's certain things called a lingual holding bar. And what this is pretty much what so they'll cement them or we use composite resin. We don't use cement. Sometimes people do, but most of the time you use composite resin, right? On the backs of your teeth, on the top teeth and on the bottom teeth, especially with the front six at the bottom and at the top. We'll put this there and it'll kind of help to keep those teeth in place. And so they won't have the probability of moving. They'll kind of help keep them in straight, right? So that's the short version. And again, I'm not here to diagnose with anybody or anything like that, but um, that's pretty much what you have going on right there. Like you, that's why they always say that you need to wear your retainers, because those teeth will start to shift again, and you pretty much lose money. You'll lose money. Because you didn't pay. Sometimes I took my kid not too long ago, man. And them braces were $5,000, man. I couldn't believe it. That's a lot. That's a huge investment. So you better believe my son is gonna be wearing his retainers, or we're gonna get a lower lingual bar or something like that to help hold those things in, just so that they don't shift over time and my money doesn't go down the drain. Let's see. One thing my dentist never shows me my X-rays. Is this common unless there's a problem? Um, I guess it really just depends on where you're going. Now, what I'll share with you too, Sweater Factory, is like, so if you are going to the dentist, right, and they say that you need some certain types of treatments or whatever like that. So if you sitting in the chair, the dental assistant takes the pictures, and they're asking you like, okay, so you, Mister Sweater Factory, we got 10 fillings that we gonna have to do. I think you should probably ask to see those X-rays before. And a lot of times, the other thing that you can do, they're not diagnostic, but you can ask for a copy of your medical records, and that includes your X-rays as well as any notes that you have. Some of the where I work, we do a lot of we have to do a medical note, right? So we'll do like all of the things: your health history, the medications that you take, your chief complaint, the medicaments that we use to fill the tube, whatever we do, surgeries, whatever. It's a 4-page letter as far as the notes that I do when it comes to patients that I treat, right? A lot of these private offices, they don't necessarily get too far in the weeds as the place where I work does. I'm not going to share where I work, but the place where I work. So a lot of times, you don't necessarily get all of the things, and a lot of doctors may not show you that. But it's absolutely you're right. That's the short answer. You're right to be able to see. It's just like you going somewhere and somebody's saying that you got cancer or you got something, and they don't want to show you the records though. That's messed up. You know what I mean? Like, I mean, you gotta advocate for yourself, man. You cannot do that. I would, and I think a lot of times, and that's the trust that, you hit it right on the head, Sweater Factory. That's the trust that everybody has with healthcare, right? We're just like, well, shoot, we're just gonna believe whatever, you know what I'm saying, whatever they tell me. That's what it is, I guess. And then we end up, finding out that it may not have necessarily been that bad. And that's why it's important. I always tell everybody that I treat or come across on this platform or wherever, your health is your wealth. And, you can only go as far as your health will allow you to. And so being an advocate for your health early on will probably make the difference in your 50s, 60s, 70s, 80s. And that's something that, I try to empower my patients with. And then also you guys that's on the call right now. It's important. But you can ask. You can ask. You should ask. I hope you ask next time. They gonna be like, man, you've been talking to somebody, huh? They be like, who you been talking to, man? But yeah, you definitely need to ask, especially if they're trying to get you to do a whole bunch of treatments, man. Yeah, no. She has shown me them on the screen that I have 5 fillings in total, but I never get a printout of it. You can do it, for real. Appreciate you from Turkey. Blessings, man. I love it. Man, this is so awesome, dude. So humbled by this, man. I had somebody on from the Philippines, got somebody on from Turkey. Man, this means so much, man. This is what it's all about. I ain't even gonna lie to you. This had somebody on from Japan. This is dope, man. I am so humbled just to be able to touch the world, man. This is awesome, man. This is so awesome. And y'all maybe I'm about to get back on this editing, man. Y'all got me over here just straight up feeling too good about myself. I gotta get myself together for real. But I appreciate, all that are
Recession
on,
works the
man.
same way. It's slow, it's sneaky, and if you don't catch it
Blessings,
early,
man. I
it can
appreciate it,
actually
man.
get you
Sweater
stuck
Factor, hey,
your
man.
entire
You got a
spine.
friend in me, man.
What
If you haven't
causes gum
subscribed, man, I
recession?
hope that you do,
Here's
man. I
what my
hope
research and
our
clinical
interaction would
experience
have
shows.
helped you to,
Aggressive
one,
brushing with
take advantage of what it is that you do, and then two, take advantage of your healthcare, man, your oral health, man, because it's important. So I appreciate you for jumping on the live, man. It means a lot. And you had some really good questions too, man. And I know these questions weren't just for you, man, but somebody in the chat at one point in time, man, I had about a good 18, 20 people in the chat, man. And so having somebody, asking questions and stepping out on a whim, man, it means a lot. Not just for you getting information, but for somebody else that chose not to ask. So I appreciate that for sure. Man, look at me. I've been on here almost an hour, man. This is dope. This is dope. Wow. That is dope. Man. Truly humble, man. Let me get back on this video.
reshape your entire spine. What causes gum recession? Here's what my research and clinical experience shows. Aggressive brushing.
If I'm getting a root canal, is there anything I should be worried about? Yeah, there's a lot. There is a lot of things that you have to be worried about. I think one of the things, especially if you're not getting it done by endodontist, is you probably need to see about um, one, making sure that they know how to do it. So, like, if you're getting a root canal, one of the things that a lot of people don't talk about is root perforation. And so that pretty much means that, so we use these little files, they're called K files, right? And sometimes, put in the wrong hands, you can pretty much make a communication outside of the tooth. And so if that happens, the tooth is not salvageable. A lot of times you can't feel that. So if you have a perforation in, like, say, in the mid root, one is going to create an area for infection to travel, and then two, it could lead to cracks, and then if it's cracked, then it got to come out. So I think that's probably one of the things, just making sure that whoever you choose to have this done really knows what they're doing and do it often. Not necessarily know what they're doing, but they do it often. Because a lot of times, and even if you can maybe go to a place where they have microscopes. So if you're gonna pay for a root canal, you need to go somewhere where they really gonna do the thing. So you need to see about having your general dentist refer you to an endodontist, or you can potentially see about maybe going to a general dentist, but they specialize in it. They do it a lot. That's probably what I would do. Oh, my boy sweater. That's another controversial treatment from what I have read. A lot of wholesale dentists hate them, but wonder if that's because they want more money in implants. So, man, you got a lot of good questions, man. I'm gonna have to collaborate with you because you got some Sweater Factory you was on today, man. I appreciate that. So one of the things about implants and root canals, right? I got a video actually too. That's I think I'll talk about that. But the difference between implants and root canals. So implants have a really, really high success rate, right? Um, and there's another video that I have where everybody's not a candidate for implants. And if you're not a candidate for implants, sometimes root canals are a good option. Um, Root canals, given and done the right way, um, are fine. There's no real issues with those. But a lot of research is starting to come out where, sometimes when you have something that is dead inside of your mouth or in your body, sometimes it can lead to other issues. And so I think there's a lot of controversy when it comes to root canals. I've done them. I've done a lot of them: molars, premolars, incisors, canines, all of those things. But I think Implants are more expensive, but the probability of implants are a lot longer than um, the probability of a root canal. Because one of the things that people don't really think about, so when you take out the nerve, the blood vessel, the artery outside of a tooth, what ends up happening is the tooth loses its nourishment and the tooth becomes brittle. And sometimes, not all the time, but sometimes the tooth can actually crack or break. And so now you're out of um, you're out of money. So you pay for this root canal. You pay $3,000 for the root canal and the crown, and you have a cracked tooth. Whereas with implants, those can fail too as well. But the success rate of placement and especially with patients that have a good regimen as far as coming to see the dentist, there's a lot longer. So I guess it really just depends on um, who you talk to and what's favorable for you. Again, I'm not diagnosing, just talking. But I would definitely encourage you guys to at least see what works well for you. So if you're taking a lot of medications and you have not a whole lot of bone, or you have brittle bone, you have bone issues and things like that, implants may not necessarily be the way that you need to go. But um, it just really depends. Yeah, yeah. It's a lot, it's funny that you said that because I think just everything in general. Sometimes just I kind of consider teeth like people because sometimes you have some that act up. Sometimes you can have some bad teeth. Sometimes you can lose teeth, just like you lose people around you in your life. So I kind of consider teeth almost like people. You know what I mean? So like everybody got problems. Something got problem. But if you stay on top of your oral health, you stay with a good sound dentist, I'm sure that you'll probably have a good result, man. Even you just being on this live right now, asking these questions, man, you're gonna be all right. I can already tell. All right, Angel Orange. This is the last question I'm gonna take. I haven't been on here for an hour, y'all. This is crazy. Are root canals painful? It just depends. So, like, if you have an infection before, sometimes getting patients that have a large infection numb is really hard. It's difficult and it can be painful for the patient. And so, you may have pain, discomfort. Earlier, I talked about, and it sounds like you've been on pretty much for the whole time, Orange Row. When I was talking about those periodontal ligaments. So sometimes when we're doing root canals, right? And we're doing root canals and we're moving the tooth up and down with drilling and things like that. Those ligaments, just like you can sprain your ankle or your thumb or your knee or whatever like that, they can become sore. And so sometimes you may have to take over-the-counter anti-inflammatory medication or some type of pain medication, Tylenol, whatever, to kind of help you with some of that pain discomfort that you may have after a root canal. But it really just depends. I mean, it just depends on the patient, case by case. Everything is the same but different. And in healthcare, I've learned that over the years. It's just there's a lot of things that are the same, but you can't get to the point to where you just feel like everything that um, you just can't think that everything is the same. Because once you start doing that, you are going to run into a lot of problems, a lot of problems, a lot of problems. Man, this has been awesome. I appreciate everybody that's put a vote in. I appreciate everybody on the live, man. This was a good one. I'm definitely gonna post this so that everybody can kind of glean from all the questions and things that y'all have, man. I appreciate everybody on the call. Y'all be blessed.